All right. Good afternoon, everyone. Hello, welcome. Greetings to you. We're excited to have you all here today, and thank you for joining us for today's webinar. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, also known as the P4HE Collaborative. We are a national research learning collaborative based at the Tulane University School of Public Health and Tropical Medicine and sponsored by the Robert Wood Johnson Foundation. Here at P4HE, our aim is to bring together the various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We convene these sectors to bring together people, organizations, anyone who wants to work to better understand critical issues related to attaining health equity. As we begin our second year of activities here at P4HE, we're going to do so with today's webinar. We want to share with you some of the things we learned from our first year of activities and where we're headed in year 2. Additionally, we want to present a conversation on urgent matters affecting equity and social justice with Han Cal Yu of the California Endowment. Lastly, and most importantly, we want to hear from you about your interest in these topics and needs for future activities. So let's actually start with that, hearing from you. Let's get to know about your insights on what we need to address in the field of health equity. We'll start with a poll using Mentimeter. You join the polls on your browser or a second device like your cell phone by clicking on the link in the chat or going to menti.com and entering the code that is at the top of your screen. And since this is a collaborative, I'm going to do the poll in real time with you. So I'm gonna pull out my cell phone right here, go to menti, METI.com, and type in the code. Here it is, 895-09147. Okay, hit submit. Instructions, thumbs up, got it. All right, and with that, what should show up is our first prompt, should be showing up here soon. Here we are. Our first prompt is, what are you hoping to get out of today's session? So once you're in Menti, you can go ahead and type in your response to that. What are you hoping to get out of today's session? I'm going to type in my response right now. Again, this is a collaborative and interactive session. All right. I see some responses showing up. I'm a little bit slower. Let me type in and hit submit. We see inspiration. Me too. I'm definitely looking for that. Engagement, learning more about your work. We're learning more about each other's work. Learning about health equity, definitely getting a preview for what's next for the collaborative. We definitely have that ready for you. The status of health equity efforts, definitely. I think that's important. And we're happy to have Han Cal Yu here from the California Endowment, who is at an organization that is helping to lead these efforts. So we're excited about that. What else? An update on things, where things are with P4HE, yes. Finding out more about the work that is being done around advancing health equity, yes. We're going to do that both here today and then talk about how we will do that throughout the rest of the year. Great. Okay, should we move on to the next prompt? Okay, the next question is, what equity-related issues are most impacting you, your work, and/or the communities that you serve? So what health equity or equity-related issues are most impacting you, your work, and the communities that you serve? Okay, I'm going to participate too, so we can all do so. Okay. Racism twice, 3 times. How to evaluate impact? Yeah, that's definitely. Everyone doesn't have the same 24 hours. I think I've been looking at research where we're thinking about time as a social determinant of health. So yes, and definitely inequitably distributed across our society. Structural racism, again, which clearly that is an issue, a concern, a sort of organizing principle in our society that impacts equity. Healthcare as a commodity rather than a human right, definitely thinking about the ways in which classism and sort of capitalism in our society structure impacts something that should be a human right. Yeah, environmental racism, gun violence, and lack of housing equity. Those are definitely issues as well that impact us as individuals, impact our work, as well as the communities in which we serve. Oftentimes, those are our own communities. Awesome. Thank you so much. Thank you for participating in, sort of, maybe you have or haven't used Menti, but I think it's an impactful tool for us to share, particularly in a circumstance or a context like we're in here. So again, thank you. You can continue to share your questions and thoughts and comments in the chat throughout today's discussion, since we are here on Zoom. So feel free to jump in the chat to discuss. But you can also join this conversation with your thoughts and comments on Twitter by using the hashtag P4HE. That's hashtag partners, the number 4HE. Okay, so we'll continue to be engaged throughout this conversation, but also on social media. We're going to move along and welcome my colleague and fellow P4HE Associate Director, Andrew Anderson, for an overview of P4HE's activities and some of the things we learned in 2022. Andrew?
Thanks, Karen, and good afternoon, everyone. Thanks for joining us. As Karen mentioned, I'm going to go through a bit of an update on what we've been up to in 2022. So in 2022, P4HE grew from a whopping 0 members to 212. As you know, our launch was in March of last year, and our members represent several sectors, including academia, the civil sector, government, private practice, philanthropy. Our membership continues to grow in numbers and expanding its demographic and multi-sectoral reach. We've had success in keeping with our aim to engage with these groups in insightful conversations on timely topics and promote actionable solutions. So each of our webinars have been centered on addressing a key issue. I'm going to spend a few moments going over some of the important resources we've developed in 2022 that are freely available to everyone. We curated a large set of resources in our resource library. It's up to about 129 resources, and towards that end, we've continued building our website's library, including collaborative original research content, such as evidence syntheses and webinar reports. These syntheses came to, the purpose of them is to condense and summarize science that can inform efforts to increase health equity. And our webinar reports distill key conversations and learnings that we've had throughout the year. And we'll continue to be posting these webinar reports after we conclude each one of these convenings. P4HE also launched a podcast series featuring conversations with people who have made significant contributions to improving health equity. And we'll have more information on the series coming up in 2023. In 2022, we also facilitated 10 virtual engagements, including webinars, membership interaction, and interactive sessions. And through these webinars, we've had experts and others, in exploring health equity issues of related to pregnancy-related mortality, LGBTQ+ health and policy, media and health, structural and gun violence, housing, nutrition, immigrant health. So topics across a wide spectrum. Our 2022 activities culminated with the P4HE Hybrid Health Equity Summit, which was hosted in New Orleans in December 2022. The summit was a success, and we'll be sharing more about the outcomes of the summit in future convenings. The collaborative continues building the foundation for expanding outreach and programming with a focus on continued learning and supporting multi-sector collaboration. We thank you for your continued engagement and feedback. It's been so important for us to improve this effort. And while we're learning, we recognize that learning needs to be accompanied by action. A lot has happened over the last year alone, and today we'd like to talk about some of the recent and ongoing problems or issues that have an impact for health equity work. So I'm going to pass it back over to Karen, who's going to introduce the rest of our panel.
Okay, thanks, Andrew. You're actually on the panel, so we'll start with you, but additionally, we will have Han Yu. Han is the Chief Learning Officer at the California Endowment. And thanks for joining us, Han.
Thank you for having me.
Thanks. Okay, I actually want to start with sort of a broad question and then get into more details. This question is to you both. You can answer in whatever order, however you want to, but how do you think the national conversation around the concept of health equity has changed over the past couple of years?
Would you like to go first? You can go first.
Okay, sure. Well, first of all, thank you so much for having me. I'm delighted to be a part of the advisory group for Partners for Health Equity and also to be invited for today's conversation. That is a great question, Karen. Certainly, the nation is at a crossroad right now. We've had a trifecta of crises, whether it be the pandemic, with the economic downturn that it's induced, the national reckoning of structural racism triggered by the murder of George Floyd, and also the deep political polarization as symbolized by the January 6th insurrection. So all of those have really shed, in my belief, longstanding systemic inequalities and vulnerabilities in our communities that are faced by our communities. And what I'm seeing is that so much of the nation is in denial. There's a lot of fear and backlash that's happening within that. And so within all of this, we're seeing a huge rise in white supremacist violence, ignoring of public health advice. And, you know, we're even seeing in the denial of teaching of histories with critical race theory. And most importantly, the rejection of democratic norms. So that's all really worrisome. And I want to share that I'm definitely speaking from the perspective of someone in philanthropy, as well as bringing in our communities perspective, where, well, there's still a lot of work we need to do in California, where I work and live. We're taking a different approach than some of the other states, where we are embracing science to really attack COVID. We're around climate. And that we are choosing to extend many forms of aid and support for Californians, regardless of their immigration status, where we know there are lots of vulnerable communities that have been under attack. So bringing that equity lens to economic recovery, relief, and resiliency, all that's really important. And I want to just underscore the name of this, the title of this webinar, where I think we need to move to action, less about conversation and more around action.
Yeah, I totally agree. Thank you. Andrew, what do you think?
Yeah, so I think all of what you just shared really sets the foundation for, I guess, this question. In my opinion, and as a researcher, there seems to be a lot more people willing to move or wanting to move into the research space, into the health equity research space over the last few years. Some of that seems to be, you know, a genuine interest in looking for meaningful solutions and seeing how they can integrate this into the work that they've had already been doing, you know, and understanding that, you know, health equity, especially, you know, when doing public health and healthcare research, is something that should be a consideration for most of us researchers. I think the other reason that some people have moved into it is, you know, in research, a lot of the time it's following the money, right? So there's been increasing funding from foundations, but not only foundations, but NIH and other, government funders have put money into trying to measure structural racism, to try to, look for community-based solutions to some of the problems that we've, was just raised. So I think, there's a combination of genuine interest and, and more of because of, the events of the last few years, the public attention, people are paying attention and realizing that, how they can contribute. So, and I think we've seen more elevation of voices from people who are impacted in ways that, maybe previously wasn't to the same degree. And I'm not sure if that's going to be, continue in the same way. It seems, just my personal opinion, it seems like some of the energy is starting to wane. But it's now I'm thinking about how can we kind of keep it going, because we know that national attention shifts from issue to issue. And so how do we kind of keep this in the spotlight and recognize that health equity is going to be an underlying issue in relation to just about everything. So.
Yeah. No, I definitely agree. I think, even thinking back to that poll that we just did about what are the pressing equity issues in your life and in your work, the number of times that we saw the term structural racism, coming up is clearly prevalent, but structural racism is not new. And so thinking about how, attention to this particular, something like structural racism, health equity issue, how attention wanes, how it goes back and forth, and how people who are committed to addressing that cause in particular, but also other causes, sometimes the spotlight is there and sometimes it's not. And how do you continue to sustain that work as well as combat the inequities in power? Just like you said, some people who are interested in addressing those topics might be doing so to, chase or follow after the funding money to address it rather than being deeply committed to it. So yeah, I think that that's important. One thing that I wanted to ask specifically, Han, since we have you here from the California Endowment, is if you would want to share a little bit about either your philosophy or the California Endowment's philosophy or approach to achieving or addressing health equity, anything that you would want to share with us. And again, I'm taking the opportunity because we have you here. So please go ahead.
Yeah, and thank you so much for that invitation. I have so much to share, but just to kind of harken back to the earlier question and thinking about the work of the collaborative, especially around promoting cross-sector collaboration. And then I know we were also interested in terms of what's happened around Roe versus Wade, some of these things that are very troubling, that I would argue that what we're seeing is a failure of democracy. Because when you see kind of a small ruling elite making decisions for the masses where there is disagreement in terms of reproductive rights and choice, these things really matter in terms of how we think about building the civic muscle of our communities to really weigh in on issues around structural racism and equity. And so what I want to share is we've been on this journey for the last 10 years at the California Endowment around place-based policy systems change. And that builds on even on previous decades of work. Where I want to start, we were founded about 25 plus years ago and have been 3 different decades of work as a health conversion foundation. We started out thinking about how critical it is to promote access to quality healthcare services and coverage and a highly culturally competent workforce. And then soon realized that it was not enough and that we need to be thinking on a larger scale around policy and systems change through supporting policy advocacy. And that's where we started our work under Building Healthy Communities in 2010 and realized that that alone is not enough. We heard so clearly from our communities in terms of what it takes for them to be at the center of many of these changes that address structural racism. And so that's what I want to share just in terms of thinking about the long-term sustainable kinds of investments that philanthropy needs to think about, and not just the 1 year, 2 year, 3 year grants, but even longer, more sustainable efforts that will build that. And so there are just some really important key lessons that we take away from that I want to share. The first is that we are very invested in the building of people power, that they should be at the center of decision-making. They should be at the decision-making tables. And that power building of communities, especially those from marginalized communities or historically disadvantaged communities, is an end in itself. It's not, it is important to get to the policy systems change that we want within our cross-collaborative sector work. But the important thing is if community members are able to see their success in one issue area, whether they be safer communities or more sidewalks, for their children to walk in and not worry about being run over, that if we really focus on those, they can transfer their sense of agency and their approach to problem solving and problem definition to other kinds of issues. So I think that's really important. And that's how they make their vision of health equity a reality. And then secondly, we don't shy away from supporting organizing and base building. But that in itself is really important because that's the ability to then define the solutions through a very empowered ways for communities. And finally, just appreciate the opening poll because tackling structural racism is critical. We kind of came on it in a way that was indirect, and our community said we got to take it head on, and we've done that, and we're doing it even more so in this decade of work. It just in terms of really examining the root causes of inequality and not addressing the symptoms. So my message around the key learnings is that we've got to move beyond the incremental approaches and take even bolder leaps to address health equity and justice. So that's kind of an overview, and we certainly have a lot of recommendations in terms of where we need to focus in terms of future directions, but I'll hold off on that. So thank you for that opportunity to provide an overview.
Yeah, no, thank you so much. And I think that, the first, well, all that you said, but what really stood out for me was people power and empowering, and really it's kind of like not even giving people power, but moving out of the way or that type of approach so that communities and the people in communities are empowered. And I think that we're attempting to do that here at P4HE at our summit in December. We had several community organizing organizations. Excuse me for using those two terms or those two words back to back. But and so we're trying to begin to do that here at P4HE, and I think that that's a critical issue. So thank you for sharing that. And my wheels are spinning just thinking about all that you said. But you mentioned maternal mortality and Roe versus Wade. Actually, last May, Andrew mentioned this before, but last May we had a webinar on health equity and pregnancy-related mortality. And back then it was May 2022. We touched on the possibility of the rollback of Roe versus Wade, but now that's a reality. And so my question to both of you is, how can a cross-sector collaborative like P4HE support equity related to access to abortion and maternal health care and those types of things? What do you all think about that?
I can take this first go at this. So as a researcher, I think about, and as a person who's in the kind of health policy, I'm in a health policy and management department here at Tulane. I'm thinking about the fact that for a long time, when it comes to Roe versus Wade, people have been working on issues related to abortion and women's healthcare, researchers for decades, and obviously policy advocates. Many of them are in this space and anticipated that something like this could happen and was likely to happen. And so I think, and I'll just share this one perspective. I think one of the most alarming most alarming aspects of what came out of this was kind of the highlighting of the non-apolitical nature of our judicial system. It started with the leaking of the draft decision on a major case. And then there was increasing media coverage about, the politicalization of this court. And, so I think that idea that the court is apolitical is dispelled. And then there was a number of bitter fights and blocking of confirmations over the last few years. And there's a clear bias in the appointment of federal judges. And so all of this is it's disheartening, but it's also, at least it's been pulled out into the open. So we can be clearer about the challenges that we are confronting, not only in enacting, the policies that we care about, but also in the courts. And I know that there is a bill, the Women's Health Protection Act, that has been put forward a couple of times and put down in the House. And so it's, I think, going to be brought up again this year. So when I think about, to your question about, what can members of the collaborative do, since we're all here, interested in this work, a big part is getting our representatives to, implement policy to better protect the rights of women in this country. And we know that we'll, not just on this issue, that we may need to also preempt other decisions that the court may make that are political in nature, to make sure that those rights are fully protected. And so those are my initial thoughts, is this, the spotlight that went on the court during this whole debacle.
Thank you.
Yeah. And thank you, Andrew. You answered that so well. And I think the only thing I would add is nothing is apolitical. And I'm saying from a standpoint of a foundation where we don't support lobbying, but we certainly invest a lot in building people power and recognizing how important political power is in different arenas, not just legislative, but also judicial and private sector. I mean, all of those are really important because key decisions are being made that affect communities, and in many instances harm and exploit communities as well. So we've got to make sure that there are watchdog groups constantly paying attention. But to go back to the P4HE's cross-sector collaborative work, I would really challenge us to think about what's the vision for collaboration, cross-sector collaboration. What's the so what of all of this? If it's about building the capacity and the power of the collaboratives themselves, it may not be sufficient, even it's for increased access to health and reproductive services and so on. There has to be something larger, and I'll just be a broken record about it in terms of thinking about putting communities that are most impacted at the center and making sure that they're at the center of developing the agenda for social change, for around women's rights, women's health, along with all of the other things that we know historically have been taken away from our communities. And so I think that's a really important one to be thinking about. And back to this support for democracy, elections matter. And so we have to be thinking about how are we making sure our communities have voice in light of so much of the political, the voter suppression activities that have been going on.
Yeah, I think that's critical. What you both said, obviously. Thank you for Andrew bringing in, in the list of sectors that I listed at the beginning, government was first, but you pointing out the judicial area of government, I think is important. And I think sometimes we just think about even just health policy rather than thinking about legislatures and the judicial arm of government, I think is critical. But then also, defining what is our goal and censoring those voices, not only censoring the voices, but censoring the outcomes and the work of those who are most affected by this. We, in the webinar that was mentioned in May, we had people who were doing doula work, who were doing reproductive justice work for women and birthing people, as well as we had a woman who works with Indigenous people in Arizona and shared not all, but some of that information is culturally protected as it should be, but things about doing reproductive justice work out there in Arizona. And we also had a scholar who studies pregnancy and birth outcomes in people who are using drugs And so thinking about how we should not be stigmatizing people, particularly those who are most marginalized, and not just bringing their voices, but centering their experiences and their outcomes. So I thank you both for lifting those up, because that kind of spans all of the sectors that are involved in this outcome. But I wanted to ask about another outcome that has a lot of cross-sector involvement, and we need all sectors to be involved in the solution, and that's climate change. We've had numerous climate disasters across the globe. Here me and Andrew and everybody here from Tulane is in Louisiana, Hanier in California, where there are lots of climate issues, but they're all over the globe. And I wanted to ask you about maybe even just talking about the concept of health equity in regard to climate change and climate disasters, and then maybe what we should be thinking about as a cross-sector collaborative in that regard.
That's a great one. It's interesting because we as a Health Foundation think the topic of environmental and climate change is so enormous, like what's our role within it? And up until the COVID crisis, we were largely doing environmental justice work, but in terms of directly, it's been throughout disaster response fund. And that's always felt very reactive to us because, there have been so many fires and those kinds of things that we've had to react to. And when we then issued a bond, a $300 million bond, we went into debt to say, what can we do even more around climate resiliency kinds of measures? And so your question prompted me just to say it's undeniable that disasters are increasing and that climate change is a large contributor to that. In California, we've already experienced prolonged and intense droughts, intensive heat, year-round wildfires. Those have been so scary because I remember just looking out the window and the sky was just orange. It felt like we were on Mars and not Earth. I mean, it was that scary in terms of how polluted the air was, and it wasn't safe to go outside. And so what we're seeing is in the next decade, there will be consequences to loss of lives. I mean, we're already seeing it now in so many developing countries and around even the now states, and that there are negative health outcomes socially, physically, and mentally. And that I worry a lot about the irreversibility of the threats to our biodiversity. And so it's going to impact generations to come in terms of what they're going to be facing, and along with that, increased racial and wealth gaps. And so all of those are just very much present. And for us, we're thinking in California about how this is elevating the ongoing health risks, degrading air and water quality, and threatening our food supplies. We are one of the largest food suppliers in the nation, probably the world, with the California agriculture. And yet we don't have the water to even water all of the crops that we have. And so where we've really focused on climate change has been to really intensify our investment in both rural and indigenous communities that have suffered disproportionately from climate change. And no one is immune from this, but low-income communities and communities of color bear the brunt of the short and long-term effects. And so what I do want to say is, as federal dollars and state dollars are coming into our communities, we want to make sure not only that the money is leveraged and available to our communities, but they're in the driver's seat, really defining and telling where that should be going, and not, the money should not be going to the usual corporate and others who are always ready and first in line to use the funds. So I think just lots to think through, but it's something that we just cannot ignore.
Yeah, I agree. Thank you. Andrew, any thoughts about that?
Yeah, so I was kind of related to the previous question, where I think, so as a researcher, I think of myself as, when I'm reading my research hat, because you can wear multiple hats, is, providing, to the extent that I can, the data that communities need or want. And obviously that starts with asking them and working with them to figure out what what data could be supportive for these efforts. And so, and that, it's related to the previous question, but also, I think, Han was alluding to this too, that a lot of data has come out in the last few years around climate change. We know that the Native American, Alaska Native populations are more like, our tribal lands are more likely to be areas with extreme heat and wildfires, and Black people are more likely to be living in areas with extreme temperatures, and we're going to see higher mortality rates as a result, higher asthma diagnoses. I think it was mentioned, low-income people living in areas, thinking about New Orleans, with higher flooding, leading to more lost work and wages. So lots of impending damage. But I think I try to, on a positive note, we've talked about this last year, in 2021, the Biden administration did, put out a set of executive orders, which aren't necessarily super specific, but at least has prompted some of the agencies to begin thinking about how to address the climate crisis. And because of the focus on equity, they've been, proposing regulations and solutions to try to, encourage this type of equity-related policy making at all levels of government in relation to addressing climate crises that are disproportionately affecting certain communities. And then also promising one was FEMA last year announced a set of grants that they're going to be dedicating to advancing climate change adaptation, trying to adapt cities and communities, promoting risk reduction and community resilience in different parts of the country. So I think those efforts, and there's some other ones, to try to protect disproportionately affected populations. As long as we kind of keep up those efforts, that will, and I think it's going to require ongoing, again, this is like our first attempt. So some of these policies may not even be effective or implemented in a way that is actually doing, blunts its effectiveness. So I think it's going to require ongoing resources and accountability, but at least we have some, there's something in place or being put in place to try to address the issue. And that started by highlighting some of the using the data to try to show where the problems will continue to exist.
Yeah, thank you. Thank you for sharing that. It made me think of health in all policies. That was, when I was in school a decade ago, was what everyone was teaching. And so thinking about equity in all policies is the next step up. And I appreciate that. I'm looking at the chat and we have a question from there. It says, to what extent, if at all, is there interest and effort to supporting and leveraging community power groups to affect community health and organize and actualize effective advocacy, especially in regards to access and outcomes equity? This is sort of going back, but I think that, it's been a part of all of the questions. So any response to that question from the chat?
Yeah, absolutely. I think that's just critical. And I think that's the gist of all of our work here in California and how we invest. And I want to share, we've done a lot of thinking about where we go strategically in this decade of work. We're not pivoting away from building healthy communities, work that we've done in the sense that we believe more than ever in the importance of people power, and yet thinking in more nuanced ways about how we build community power. We've documented something like 1,700 wins, which is just incredible from all of our partners' work. They've identified, and they're related areas of work. But what I want to say is that getting to the wins is easier than it is to maintain the wins, in the sense that we have to set our North Star as governing power. We can do a lot of that outside in kind of adversarial type of work, but we also need an inside-out strategy as well. And so thinking about governing power in that it's the ability to set agenda, to win and protect an agenda is really critical, a political change agenda. And that means including recruiting, preparing, and making sure that our community leaders are in decision-making roles. And so we focus a lot on boards and commissions, for example, making sure that our community leaders are in the pipeline to be in those leadership roles and that they can be sustained in those roles. So that's the first thing. The second thing is to really think about how we promote multicultural democracy, and within that, particularly centering Black and Indigenous voices. Set aside identity politics. I, as an Asian or Latino populations, our voices matter, but I really appreciate that unless you address the origins of this country and our history and settler colonialism and slavery, unless we do address those, I don't think we can, all of our liberation depend upon each other. And so I think by virtue of really centering Black and Indigenous voices, I think that's the pathway to get there in a multicultural democracy. And then third, to be thinking about the narrative change work. That's hard, deep work, because it goes to the heart of our ideology, our belief systems, the norms that we need to establish about who's deserving and who's not. And very hard to capture and measure and research and evaluate, but really critical in terms of changing the public will and support for supporting the undocumented, as we've done in California, and making sure that they get healthcare and health rights, just along with anyone else, because they're key contributors to the economy. And then fourth, I want us to really think about how we invest in infrastructure, specifically the power building infrastructure of the groups that no one organization can do this work alone. So we got to work together, just like the P4HE's work around the Crosssector Collaborative work, that we all need to really be aligned around a common vision and really kind of share our resources, our skills and talents to make something larger than any one individual organization. And within that, think about the interstructure, meaning that what binds us together in terms of that in-between spaces for collaboration. I'm not sure we've talked enough about that, but using this ecosystem approach, I think, is really critical. And then I just appreciate the number of comments in the poll around evaluation and research. I think that's really critical, coming from a background of doing evaluation and research for impact so that we can make the case for investment. We got to really think about the metrics that matter, that we got to make sure that we really think through creating better metrics for accountability for public policy, that public policy makers need to be accountable to communities. So how do we really hold them to their feet to the fire around that? And then secondly, it's really important to think about how we measure community power itself, that we are in like high experimentation mode in philanthropy about how to do that. And it's to me, it's $1 million question in terms of how do we know we're making progress about building community power. So those, I would say, are some of the major ways of thinking about how this work could be taken on by P4HE.
That was a lot, I think. That
it was. You can tell a lot of thinking about it.
Right. I think we could plan a whole series on just that response. Andrew, did you want to add anything?
Yeah, I had thoughts on each one of those points, and I think I would take a long time to, and they all resonate with me, and I completely agree. Maybe just one thought that may be somewhat of a through line too is the political disenfranchisement issue is when we're talking about how to keep power and bring power back or get power to communities that haven't had it. I think it really does start with dealing with some of the voting problems, the redistricting and gerrymandering, and the way that this has also got national attention recently too, but it's still, I don't think we emphasize how important that is to keeping to us. It underlies so many of the issues that we have if we really want to create long-term sustainable change through policy. We need to make sure that these communities have the power to do so. And as we know, one of the kind of root causes of inequities is this kind of unequal distribution of power, attention, and resources. And so, and power, political power is a big source of power.
Yeah, I don't want to say I'm shocked, but I think this conversation has centered around the power inequities and even invoking the role of democracy and how we, you know, in public health, at least as an academic in public health, have always been taught to think apolitically, but really, as we've said, it's not apolitical. It's an issue that you have to address and might even have to be the center of some of our organizing, or excuse me, an organizing principle for people who want to do health equity work, especially people who want to do so in a collaborative sense. Anything else? Sorry, Han. Did you want to add something?
No, I just want to be responsive because the theme of this is to respond to the urgency. And yet I want to just emphasize what long-term work this is, to really stay the course, to be patient. And what we're doing now may not be the most sexy thing in the world. I mean, we're investing in capacity building in communities and infrastructure building, but we feel like that's what it takes to affect a long-term structural change agenda to address root causes. So yes, there are opportunities to respond in the moment to crises, but don't get caught up in that, because I think unless you get ready for these crises over a long period of time, we will always lose. And I want to really emphasize that because the opposition has been working on this for decades, 50 plus years, and they are ready at every opportunity, whether it's the Supreme Court appointments or political appointments, every single step of the way they've thought through, and we just have not had that kind of unity, direction, vision, and resourcing that we need. So that's what it takes to address structural racism. And so I put in a link to this incredible report by the USC Equity Research Institute that provides a blueprint for thinking about how to advance health equity. So really would like to invite you all to take a look at that.
Yeah,
thank you so much.
Thank you.
Thank you. I think we're running out of time. So I'm just gonna say thank you so much to you both Han and Andrew, for your thoughts and sharing with us. I appreciate and learn. I'm left with so much to think about that I'm not only thinking about applying to my research, but my life. So I appreciate you both. Thank you. Great. Thanks. Thanks to you both. We're going to move slightly, but I think actually this conversation helps to introduce our activities for this year, 2023. We have a lot going on, and we're excited to share that with you. First, we have a monthly webinar series called Moving to Action. Actually, today is the first in that webinar series. With these webinars, we aim to bring voices from all sectors with the goal of uplifting lived experiences from thought leaders and practitioners on how to make change. Our tentative titles include What Works? Setting Health Equity Visions for Success, Balancing Business and Health Equity. So we'll be looking at the private sector with that one. Building Partnerships for Health Equity Advocacy. And then lastly, Centering Global and Indigenous Solutions for Health Equity. Also, we are launching a series of virtual workshops to support the collaborative's application of learning opportunities into practice. Each workshop will have a 3-part series held over 3 months to move from learning to creating. These topics include measuring health equity, evidence synthesis for policy, as well as design thinking for solutions and more. Additionally, P4HE will continue to synthesize evidence-based research and practice in a way that is accessible and useful to all. Specifically, we are bringing together all the relevant published information about some particular topics. These topics will be informed by feedback from the collaborative from you to identify gaps in knowledge, for establishing an evidence base for best practice guidance to understand the latest science and to inform policymakers and practitioners in their decision-making. And we're publishing and disseminating syntheses in open access peer-reviewed journals, infographics, and we'll also be publishing briefs on these syntheses. So we talked about a lot of our plans today, but we wanted to close by sharing thoughts, comments, and insights from everyone here. So you can go back to menti.com or click on the link in the chat again to share some of the things that you're thinking about. So again, since this is a collaborative, I'm going to do it as well. Going back to Menti. Pulling it up, here we are. Oh, we have the slides up. And you can put in your response to this question. What information stood out to you today? Or what action might you take based on what you heard? And I'm going to respond to that as well. What information stood out to you today? And what action might you take based on what you heard? So let's see if we have any responses. That's my response. Democracy definitely stood out to me. I think that that is critical to be involved. So if you want to put in your response. Let's see, you can also use the chat if you feel more inclined. Democracy and policymaking, yes, definitely. Glad to see that those are resonating, holding our leaders responsible. That's definitely democracy in action, and is critical. Civic leadership, in the chat we see collaborative approach. Yes, that is what we are all about here. Action and listening more. I really appreciate that because especially as an academic, sometimes all we do is talk and listen without always doing the action related to that. The role of democracy and public health, collaborative approach, working across all sectors, the potential power of bringing together experiences and voices across sectors, definitely. We got to get out of our lanes. I appreciate that so much. Thanks. I think we have one more question for you to reflect on. The question is, what is a takeaway you gained from this webinar or engagement that is helpful to you in the work that you do? Oh, so sorry, let me go ahead and respond as well. What is one takeaway you gained from this webinar that is helpful to the work that you do? Okay. All right, so we see some responses coming up. Community building, hope is definitely key. I think that is a key practice really for us as people, for us who are doing work related to equity, when there are many obstacles and barriers to the goals that we want to achieve. Long-term structure change begins now and should be anticipatory. I really appreciate that sentiment and the way that you said it. The workshops, I'm excited that you're excited about the workshops because we're definitely excited about them. Connecting and sharing with others, love that as well. That's what we're all about. Okay, so thank you all for sharing. I think that we can continue to think about these. With that, we want to invite you to join us on March 15th for the first of our workshop sprints on health equity measurement. And then on March 28th, we'll have the next webinar in this series called What Works? Setting Health Equity Visions for Success. You can follow us on social media and help us spread the word by sharing our content that most interests you and your work. So with that, that is it for us. See you soon, everyone, and take care.